AMWPA is hosting a Zoom lecture on COVID-19 effects of heart today. As you know, AMWPA is a preventive healthcare nonprofit organization. I would like to start our program by reciting Surat Fatiha. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Alhamdulillahi rabbil alameen. Ar-Rahmanir Rahim. Maliki yawmiddin. Iyyaka na'budu wa iyyaka nasta'een. Ihdinas siratal mustaqim. Siratal lazina an'amta alayhim. Ghairil maghdubi alayhim waladdallin. Ameen. As you already know, AMWPA is a 501c3 nonprofit organization founded in. Can you move the slides now? Can you please move the next slide? AMWPA is a 501c3 organization. This was founded in 2008. The mission and the vision of this organization is to promote the health, welfare, and education of women. And we aim to improve the condition of women's health. We provide a platform for Muslim women in medicine and raise the awareness of issues regarding the community welfare. Preventative healthcare is our passion. In this difficult time of COVID-19 pandemic, AMWPA has not only taken the step forward to educate the masses and community about the prevention and has also provided thousands of masks in the community as well. Today, I would like to invite my colleague, Dr. Amena Hussain, who's a cardiologist and electrophysiologist with Baylor Scott & White. She practices in Plano, Garland, and McKinney. And she's our esteemed speaker for COVID-19 effects of heart today. Dr. Amena Hussain.
Thank you, Maria. I'm ready to get started on our talk. Looking forward to it. COVID effects on the heart. Natasha, are you going to present the PowerPoint? Oh, there it is. Okay, perfect. All right. Okay, very good. So I'll get started here. This is going to be a casual discussion, and I'll let our audience know about COVID effects on the heart. I myself am a cardiac electrophysiologist, so I focus on heart rhythm problems, like a too fast heart rate, too slow heart rate, that kind of thing. And I'll address some of that, but I'll also be talking about general cardiology problems in relation to COVID. Okay, very good. Next slide, please. So the purpose of the talk is to educate the general public about COVID and its relation to the heart for those with and without underlying heart disease. There we go. And as you all know, the understanding of COVID-19 is evolving. So there's a lot, everything we've learned about COVID, we've learned in the past 9 months or past year, and understanding is evolving, and there's still a number of unknown things, okay? And then at the end, we'll review the best practices to stay safe. Next slide. So COVID has a couple names. We say severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, which causes coronavirus disease 2019, COVID-19. Okay, so you'll hear it called COVID, COVID-19, coronavirus, SARS. It was discovered late 2019 and it came to the early US around 2020. And as you know, this has reached now a pandemic level, a global pandemic level, particularly worse particularly bad in the United States, but all over the world. Next slide, please. So symptoms of coronavirus. Symptoms include cough, shortness of breath, difficulty breathing, fever, chills, muscle or body aches, vomiting or diarrhea, and loss of taste, loss of smell. And mostly these are breathing and lung problems. So coronavirus usually causes a pneumonia or some breathing problem, such as pneumonia, I should say. However, the whole body can be affected, including the heart. And that's what we're going to focus on for this talk. Next slide. So like I said, COVID affects the whole body. The transmission is person to person through droplets. So what happens is we breathe it in. And when we breathe it in, it not only gets in our lungs, but the virus attaches to what we call a host receptor in many areas of the body. So that could be lungs, the lining of the blood vessels, the heart itself, the gastrointestinal system, a number of things. So it can cause, so it can affect more than just the lungs. Next slide. So during, when somebody comes in and they have a COVID infection, whether they're at home or it's a bad infection in the hospital, one thing I should say so COVID, it can range from asymptomatic to mildly symptomatic to severely symptomatic, and people die. Okay, so it's a full range of symptoms here. Okay, effect on the heart is a couple things, and I'll list those here over the next few slides. One thing I forgot to mention in the beginning, if you have questions, you can post them on our chat box and we'll answer them after the talk. Okay. Okay, very good. So one of the things that can happen to the heart during a COVID infection is you can have abnormal blood work, and that blood work is the markers for a heart attack. You'll hear the word maybe troponin. That's the marker that you get that if somebody has a heart attack, and sometimes those can get elevated in your blood. And sometimes that's from a lot of demand being placed on your heart. Your lungs are working extra hard, your heart is working extra hard, it increases demand. And sometimes it is because you may be having a heart attack. Or some degree of a heart attack there. Or maybe just increased demand, that kind of thing. You can also have rhythm disorders, such as a fast heart rate. And usually the fast heart rate we get when we have an infection, we call it sinus tachycardia. And that's the fast heart rate you get when you're ill, you have an infection, you're dehydrated, you're anemic, your blood pressure is dropping. It's also the same heart rate you get if you're excited, happy, anxious, if you're exercising, that kind of, that's the typical fast heart rate we see. But you can also have abnormal heart rhythms, and some of the common ones are atrial fibrillation, atrial flutter, and that's an abnormal heart rhythm you can see that often people having a COVID infection that we see. And you can have a range of things. You can even have a slow heart rate. And we've seen that also, a slow heart rate with COVID or with COVID treatment. And I'll talk about that a little bit. Next slide, please. Another thing that can happen, an effect on the heart during COVID infection, is you get inflammation of the heart, and that can cause damage. So you can get inflammation of the heart, inflammation of the lining of the heart, and we call that myocarditis and pericarditis. You can get heart failure because you have lung disease, and that sometimes we'll refer to as right heart failure. But all of the above things I mentioned, if they're ongoing, they can lead to an increase in heart failure down the road. Next slide. So for patients with underlying heart problems, if they develop COVID, their COVID infection could be more severe, okay? So factors that lead to a more severe infection or complications include males, advanced age, presence of illness, including high blood pressure, hypertension, diabetes, heart failure, coronary disease, and stroke, okay? And these are just kind of an example. There's other illnesses that increase your risk also, okay? And like I said, a large portion of patients who have, patients who have a more severe COVID infection will have underlying heart issues or cardiac risk factors. Next slide, please. So a growing number of studies suggest that many COVID-19 survivors, so these are for people without underlying heart disease, okay, without heart disease. And a growing number of studies suggest many of these people who get COVID-19, so COVID-19 survivors, experience some type of heart damage, even if they didn't have underlying heart disease and weren't sick enough to be hospitalized. So some people without heart disease, they get COVID, and then afterwards on follow-up, they show, oh, maybe they developed some heart problem. And the way we know that is by, we'll do echocardiograms or some imaging tests on their heart, and we can see that maybe they developed some damage to the heart. Not everyone, but some people. So if your doctor suspects that there could be a possible heart problem, your doctor may order tests, including EKG, the echocardiogram, which is the ultrasound of your heart. They may check blood work, including troponin, electrolytes, blood count. They may even get a stress test or cardiac catheterization. And if necessary, they may get a cardiac MRI also. Next slide, please. And one thing that I want to tell you, this slide is called Don't Die of Doubt. And what I mean by this is that heart disease is still out there, even though COVID is there. So some people, they may feel afraid to go to the ER, to go out. But if you are having chest pain or shortness of breath, some problems, please get evaluated. Please go to the ER, get evaluated by your doctor, make sure you get the problem addressed. Do not avoid coming into the hospital out of fear of being exposed to the virus because this could become a problem in the future. Okay, the late consequences of something happened and not having it evaluated in a timely manner could increase your risk of heart failure later. Next slide, please. Okay, so now somebody's recovering from COVID. Have I developed heart problems? Okay, so if you have symptoms, please get evaluation, number one. So after COVID, people can feel exhausted, tired. They might not be able to exercise the same way. This is for people who didn't have any heart disease before. Maybe they did have some heart disease, but either way, is it their COVID infection or is it a new cardiac problem? Is it a related cardiac problem? So if you have breathlessness, it's a good idea to make sure you get checked by your doctor, and your doctor may want an EKG, echo, blood work, stress test, CAP, MRI, some of the things we talked about, because we may not know, even after you've recovered from COVID, if you have these symptoms, we should get them checked out. Next slide, please. Yes. So another interesting topic is that sometimes the medication that we give for COVID can have unwanted cardiac side effects, okay? And this is just an example, but hydroxychloroquine, in the beginning of the pandemic, it was thought that possibly could this be a good treatment, okay? Now we've seen that it is not necessarily always a good treatment, and there's a lot of things to it. However, in the beginning, people wanted to start taking hydroxychloroquine. However, hydroxychloroquine can cause EKG changes, specifically QT prolongation, which can increase risk of sudden death. So the message here is don't take without a doctor's recommendation. Remember to ask your doctor before starting any medications. Next slide, please. So safe practices for COVID. I'm sure all of you have heard this over and over, but I will tell you again, wear a mask, very, very important. That's the most or one of the most important things you can do. Stay at home unless absolutely necessary, 6 feet apart, wash hands, hand sanitize, don't touch surfaces in public, try not to touch your mouth, nose, or eyes. And now there may be a vaccine coming up in the future. I'll just throw that out there, though I don't have a lot of answers to the vaccine. But if you may want to get vaccinated. My message to you would be to get vaccinated. Next slide, please. So that's the end of our talk. Thank you very much. Stay safe. Make sure you all look out for each other. And next, we're going to have a panel discussion where we will answer questions, have any discussions you'd like to have, and I'd like to introduce the panel members. Next slide, please. So on our panel discussion, we have Dr. Maria Vicar, who you met earlier, who gave the introduction. She's a cardiologist, cardiac electrophysiologist with Dallas Medical Physician Group, and she practices in Dallas, Mesquite, Plano, and she is AMWPA Vice President, so active with AMWPA, also doing a lot of volunteer activities and things. We also have Dr. Faik Kamali. She is an interventional cardiologist. She has her own practice called Crescent Cardiology Associates in Frisco, and she's the chief of the cardiology division at Baylor Scott and White Health Frisco. And she also practices even in other hospitals, including in Plano and things like that. She's been practicing for at least 10 years in the area. And we have Dr. Fahmi Farah. She is an invasive cardiologist. She's a CEO and medical director at Bentley Heart and is a cardiologist at the Baylor Heart and Vascular Fort Worth and other hospitals also. So we're excited to have her as well on our panel. If you have any questions, I say we start fielding them now. Okay, so we have a question. Great, so I have my panel here. So I have one question has come in, and it's, what is the long-term effect of COVID on heart after recovering from infection? I was wondering maybe if I could field that to one of the other cardiologists. I did touch upon it in my talk, but I was very general. So I didn't know if somebody else would be interested to stepping in, or I can say what I said.
I'd be happy to answer that question. So in my practice, I have seen quite a few COVID-19 patients who've come to see as a result of heart conditions that occurred after recovery, as much as 3 months after recovery. So some of the conditions that patients are affected with as a result of COVID-19, as mentioned in the presentation, is heart failure. So heart failure, a heart is a pump. Its major job is to squeeze blood out of the heart to perfuse the rest of the body. And heart failure is when that pump dysfunctions and it's not able to pump as much blood to the rest of the body. And when we're talking about heart failure, these patients are affected and it can linger on for a long period of time chronically. Some of the symptoms, common symptoms that they are faced with would be shortness of breath, fatigue, swelling in the legs, just not able to perform in activities the way they used to be. And we're seeing a lot of this in young population as well, even athletes. So this is one of the biggest things that we fear that patients will be dealing with in the long run, heart failure. So that's something definitely to be assessed by your cardiologist and your primary doctor. Take medications, avoid salt if you are one of them who've been diagnosed with this. Heart rhythm problem is another one, arrhythmia, that we're seeing a lot with young and older folks. The other thing that we saw very commonly is myocarditis. It's inflammation of the heart muscle itself. The virus is, attacking the heart muscle, and that can have a number of effects as well. Both it includes the arrhythmia and heart failure in the long run. So those are some of the common things that we've seen.
Oh, very good. Thank you so much. That's really helpful. Yes, that's correct. I agree. So we have some more questions. Next one is, what would you suggest to use to prevent sudden heart attacks from COVID after its infection? That's actually also a kind of a tough question, but a great question. Great question.
I can try to take that.
Oh, thanks.
All right. So, that's, again, as Amena said, that's a very tough question, mainly because this is a new disease that we're facing, and we've known this for only 9 months, but we do have some idea what to do. So typically we have seen that patients who are sicker from COVID are the ones who typically get these heart attacks more, although there's no general rule, but typically that's what we have seen. So when you go to the emergency room or you go to the hospital, there's a test that we do, which is a blood test, which checks whether your heart has any damage. And as Dr. Hussain mentioned earlier, it's called the troponin. And you all can hear me? Okay.
You.
So what we do is that if the troponin is elevated or it is present in the blood, at that time we feel that, okay, the heart cells are getting affected by this COVID. They're being hurt by this. So there are people in the hospital that your doctors are going to start you on some blood thinners, and they will keep you on it for a while based on how sick you are. And that is one thing that we are doing in order to prevent a heart attack. And there are medicines, blood thinners are different types. You have aspirin-like medicines and all those things, and some stronger blood thinners, because we have seen that there's a lot of clotting issues with patients who have severe COVID infection. So that is one thing that we can do, or we do, to decrease the possibility of having a heart attack. If somebody is, as Dr. Hussain earlier said, some people have very mild symptoms to begin with. We don't necessarily give them those medications because they generally tend to do okay. But anytime we have patients who are higher risk and they're sicker, then we give them a lot more medicines, and with the intention that they don't have these side effects. You try to prevent heart attacks in them. So there are some blood thinners that we can give. And we also give steroids to these patients, which has also decreased the severity of the disease. But unfortunately, we have still seen an increased incidence of heart attacks, especially in the very, very sick people. And they can go from a minor heart attack to a major heart attack. Recovery from a minor heart attack is usually good, but recovery from a major heart attack, in my experience, is not very good. My experience, I have seen that the people with major heart attacks are really, really sick.
Got it. And this is people who've had major heart attacks during a COVID infection.
Yes, during COVID. And
Got it.
Personal experience, even though I've fixed the arteries, they still don't make it because they're so sick from the COVID itself. Their lungs are so bad.
Yeah.
It's a double whammy, it's dealing with two major problems at the same time, which is very hard.
I have a follow-up question on that. Do you have any hesitation to give steroids in that situation then when they have or you just make a decision and?
Typically they're already on steroids at that point.
Yeah.
My patients that I've seen, they have already been on steroids.
Right. So you continue it.
Yeah, so I continue it, yes.
Mm-hmm. Got it. Okay, great. So actually the next question we have talks about anticoagulation here. Is there a role for prophylactic anticoagulant therapy in patients with mild symptoms and being treated as outpatient? And I think Dr. Kamali, some things like that. Yeah.
We typically, as a routine, we are not giving it as an outpatient, not as therapy, no.
Got it. Maybe aspirin, you were saying for.
Aspirin is okay, but anything stronger than that, routinely we're not giving as an outpatient.
Got it. Okay. The next question is about taking natural anti-inflammatory like turmeric to prevent heart issues. That is a tough question also. I think that there's not enough known right now to know what natural remedies may help. I don't know if other people on the panel have some other experience.
General take about natural remedies is I don't know the benefit, but I don't see any harm in taking them either. So I typically tell my patients if they're taking vitamins, there is a role of vitamins and zinc, and we do recommend them as a therapy during COVID. But turmeric and everything, if they're taking it and they want to take it, I let them continue it because I don't see any harm in continuing. I'm not very sure or certain about the benefit, but if they're taking it, I don't typically stop them.
Got it. Got it. Okay, very good. Okay, another question, heart attack and heart failure markers. I don't know if somebody would be interested.
What is the question?
The question is, can you tell us about heart attack and heart failure markers?
Okay, go ahead.
So I can take this question, and then I'll ask Tommy and Faik to help me out as well. So I think the heart attack markers are the troponin, the blood test we do, which is a marker of the heart muscle damage, and that can occur, as Amena, you said, with sinus tachycardia, when your heart rate is higher and it's beating faster, or if you have atrial fibrillation for longer times with higher heart rates, or if the patient is under the stress of this disease and they're acutely sick, yes, you will have some sort of myocardial damage. As you said, sometimes it's obvious and seen, and sometimes it shows up later. So yes, you will have the troponin leak in many patients, and the troponin may be very high. Troponin may be just in the lower medium range, and then the high would be, as Faik, you said, the myocarditis and the acute thrombotic lesions, where you make a blood clot in the artery. The blood clot is made somewhere else in the body, but it traveled to the heart, and then it can damage the heart muscle itself with myocarditis, and you will have a very high level of the troponin, the heart damage marker. And for the heart failure markers, as Dr. Hussain, you mentioned the BNP, which talks about which measures the stretch of the chambers of the heart. If they're volume overloaded with fluid, when the heart is not able to pump forward, the fluid would be pulled into the chambers of the heart, and they will stretch, and that stretch marker will tell how high the BNP, the heart failure marker, is. And there would be other heart failure markers, as you said. If the pump, your heart is not able to pump well, you will have low blood supply to your liver, your kidneys, and then the other organ damage is a marker of the heart failure as well. And then the patient will have those signs of the swollen legs, they're short of breath with symptoms. Do you want to add something else?
I think you explained it very well. That would have been my answer as well.
Yeah, nice. Very good. I have another good question here, and that is, what is the role of immunoglobulins in patients with COVID and heart issues? So IgG. I don't.
So I gave a talk on this earlier. I actually did a news interview on this. I believe you're referring to the monoclonal antibody that was administered to the president. So the industry, this is not FDA approved, by the way. This is something that's strictly experimental at this time. And when they administered it to President Trump, it was in the trial phase. So the company that created it basically said that it prevents, in the outpatient setting, for people who have COVID infection from progressing to serious symptoms. So it basically does not prevent people from getting the infection itself, but those who have it, it can prevent it from progressing to a worse phase. Other than that, we really don't have much other information about how it acts in the human body. The only difference is it's actually very similar to convalescent plasma that is given to patients who are inpatient, very sick, hospitalized patients. The only difference between convalescent plasma and the monoclonal IgG is that the monoclonal IgG is more specific to the virus, whereas convalescent plasma has a mixture of many different types of antibody.
Very good. Very good.
That answers the question.
Yes, I think it does. Is that expected to get FDA approval?
That I don't know. I know that it's in the trial phase right now. I hope it does get good outcome, because that can help a lot of the patients in the outpatient setting. And that's the majority, actually. Majority of the people are in the outpatient setting. And if it
Right.
can, yeah, and if it can prevent people from needing to get admitted to the hospital, then that would be a good thing.
Got it. Okay. Okay. Got it. And I don't know if you know, I have limited information about this, but how about convalescent plasma? Do you know?
Yes, so convalescent plasma is something that it's still in use in the hospital, primarily in the ICU setting, people who are very ill with complete respiratory failure and usually on the ventilator, with multi-organ failure, like renal failure, a lot of the more heart failure patients. So convalescent plasma is not your typical usage for every patient that's hospitalized. It's the very, very ill patients in the ICU.
Got it. Got it. Got it. Got it. Okay. Got it. Okay. Oh, this is a good question. So for patients who smoke, are they more at risk of having heart complications with the COVID infection? And what about chewing tobacco also?
So I can try to answer that question. I don't think we know. I think so far, whatever I have read about correlation of smoking, there has been no correlation that has been found between smokers and COVID infection. Although smokers obviously are at a higher risk for any complications, but so far the data hasn't shown, like it has shown in case of age, males, diabetic, hypertensive, and obese patients. I don't think there's a direct risk that has been seen with smokers having more susceptibility to COVID infection so far.
Good to know. That's good to know. Very good. Thank you. Pregnant women, COVID, and effect on the heart. Gosh, these questions are getting hard here.
Some excellent questions.
Very, very good. Very good question. I can take this one.
That'd be great.
I have seen quite a few pregnant women, actually. I see a lot of high-risk pregnancy patients in my clinic. Pregnancy women, the one advice I have for those during this pandemic who are pregnant is prevention is key. Because pregnancy has a complication of its own, in the sense that we can't give a lot of the medications during pregnancy to pregnant women. So we always have to be very careful what we can give. Pregnancy can cause a number of problems to the heart in itself. It causes a lot of stress. We know that pregnancy is nature's stress test for the heart. And you add the virus on top of that, it can go really badly. It can go really poorly. It can put the women in heart failure, arrhythmia much more quickly. And even moving forward, now that we have an FDA-approved vaccine, we are expecting to receive within the next week for at least the healthcare workers, and hopefully in phases, we're going to roll this out to public. There are two groups of people who are not studied in the vaccine study in phase 3 trial. One of them was pregnant women. So even as we move forward and hopefully out of this pandemic, pregnant women need to continue to take those precautions, because we don't know whether this vaccine is going to work in pregnant women or not, just because they were excluded from the study.
That's right. Very good. That's actually very, very helpful. Thank you so much. That's great, great answers we're getting here. Great information about COVID. Thank you, Dr. Farah. Let's see here. In fact, what is the difference? Okay. And so this question is, what is the difference between racing heart rate and atrial fibrillation effect in blood vessels by COVID-19 in patients with underlying vascular disease? And is it worse with smoking? Got it. Okay, so I can answer some of these heart rhythm type questions. So, or Maria, if you would like, you can start with that one.
Sure, yeah, and then you can please chime in too. So
yes.
As they asked the heart racing, so anything, any heart rate which is more than 100 beats per minute would be called tachycardia. And then if the patient is feeling it, it means they're feeling their heart racing. So it's a feeling that their heart is racing. So heart racing would come in many different flavors. It could be sinus tachycardia, which is the normal accentuation of the normal heart rate. So it's a normal mechanism of heart beating, but it's just gonna race and the heart rate would be more than 100. It could be a supraventricular tachycardia, which is an abnormal mechanism of the arrhythmia, and then your heart would race. Or atrial fibrillation, which could be one of the supraventricular arrhythmias. The only differentiation for the atrial fibrillation from other types of heart racing would be that any heart racing can cause palpitations. In the long term, if your heart keeps racing, it can cause heart failure. But atrial fibrillation, in addition to causing all these bad things, which I just mentioned, puts you at increased risk for stroke as well, because your left atrium will get pooling of the blood. It won't be able to pump efficiently, and the stagnant blood will make blood clots, and they can travel to the different vital organs like brain and cause stroke. So atrial fibrillation is different, and we have to respect this disease. It is the most common arrhythmia. A lot of people have atrial fibrillation, especially heavy patients with obstructive sleep apnea. The risk factors would be age, hypertension, diabetes, and so on. So these would be two differentiating things between any heart racing and atrial fibrillation. Is the second question related to this? And maybe you can take.
I think the question had to do with, is that different for patients with underlying heart disease? Underlying vascular disease or smokers. Yeah. So I think this is a good opportunity to let people know that atrial fibrillation, we say AFib, and arrhythmias are separate from a lot of the, we call it the plumbing issues, right? Like the blockages and the heart attack and the valve problems and weak heart and things like that. However, they're related, but your risk in AFib of having a stroke, will be higher if you do have coronary disease or vascular disease, if you've had a stroke in the past. However, it's even there, even if you don't have vascular disease, so because the arrhythmias like AFib, SVT, like Dr. Carr mentioned, those are the electrical problems of the heart. In addition to what we've talked about, personally, yes, AFib is the most common arrhythmia, and what I feel like I've been seeing more with COVID is more AFib, and it's a really tough one to treat because when somebody has any infection, not even any lung infection, bronchitis, pneumonia from whatever cause, or COVID pneumonia, it's that much harder to get the atrial fibrillation under control. So even if we do get it under control, if their lung condition gets worse, often they revert back to atrial fibrillation. And the ways we like to get atrial fibrillation under control, sometimes we actually have to give the patient a shock to take them out of AFib to bring them back in. We start blood thinner. We make sure they're on blood thinner throughout that. We check that there's no blood clot that has already developed first, of course, but we can go through all of that, and then they can go right back into AFib because their lung disease could be getting worse. So sometimes what we have to do is we have to say, okay, you know what, we're going to actually leave them in atrial fibrillation. We'll make sure that their heart rates are controlled. And then as their infection, and focus on treating their infection. And as their infection gets treated, hopefully, it'll be easier to get their atrial fibrillation or arrhythmia under control. Okay, let's see. I'll move on to the next question. Okay, how much salt do we need to limit during heart failure? Does anybody have a number for that they tell their patients?
It's usually less than 2 grams a day.
2 grams.
Less than 2 grams a day. Okay, got it. And too much caffeine on the heart. How much caffeine do you recommend your patients drink daily? Not more than,
yeah, 1 cup in the morning and 1 cup in the afternoon should be okay.
Yeah, got it. Yeah, I often say things like that also, or if they're talking about an arrhythmia like atrial fibrillation, I'll tell them if they have if they notice that every time they have that second cup of coffee, that's when they go into arrhythmia or AFib, then that's too much coffee. And same with alcohol, I say the same thing. If they have 1 glass of wine for, for our patients, if they notice, oh, that when they have a second glass, that's when they have AFib, I tell them that that's too much. But the recommendations, I believe, on alcohol are one, and to let me know if I'm wrong here, 1 serving a day for women, maybe 1.5 to 2 for men. Is it something?
It actually changed.
did.
So we had a large study that came out roughly 2 years ago, a year and a half ago, and it showed that no amount of alcohol is good. So we no longer recommend any amount of alcohol. It's best to not take any. It was the largest study ever done on alcohol, involved thousands of patients. So
Very good. Thank you.
Very
So
good to
much.
know.
Great
One more thing
information.
I'd like to add. So alcohol is a trigger for atrial fibrillation. As someone asked, what is the difference? So alcohol would trigger your atrial fibrillation in some of the heart racing. As you know, with holidays, a lot of young patients get admitted with the holiday heart syndrome. Their heart is racing just because they drank alcohol, and the heart would be racing. And the second thing I would just briefly touch on, how much salt do we need to limit? I think the patients just need to get educated about learning how to read labels for sodium on different food items. I think that's the most important thing for the community education, that whatever you buy when you go for groceries, or if you go to a restaurant, just see how much salt everything has, because a lot of people think soft drinks do not have sodium because they don't, it does not have a salty taste, but soft drinks have a lot of sodium in it. So I think that's that's a confusing concept. Some people have it.
That's really important. I agree. That's great. Great answers. Okay, great. Okay, so I've been asked to let the community know about symptoms of heart failure. I think we touched upon them, but it's always a good reminder, for people. If somebody wants to address symptoms of heart failure.
sure, I can do that. So some of the most common symptoms of heart failure would be shortness of breath, swelling in your legs, not able to lay flat, using multiple pillows to prop up your head because otherwise you cannot breathe, reduction in your activity tolerance, fatigue. Those would be the most common symptoms of heart failure.
That's right. Yeah, I agree. That sounds great. So if you have any of these symptoms or other symptoms, chest pain, shortness of breath, lightheadedness, dizziness, fatigue, then please get evaluated. That would be the message there. Okay, very good. I didn't know if anybody wanted to take over. I think our questions, we've had a lot of really good questions, and our questions have been really well answered by the panel. Thank you so much.
Dr. Hussain, thank you so much for this wonderful talk. And then I would like to thank your panel for answering the questions and educating the community. Someone asked about sleep apnea. So yes, it's important to get tested for sleep apnea and get the appropriate treatment for sleep apnea. It is a life-changing treatment for some of the patients, for no matter heart failure, atrial fibrillation, and so many other things. So I would like our viewers to encourage and check out our YouTube channel, and then check out our website, amwpa.org. The YouTube channel is a great effort by our doctors members for giving educational lectures for the community, lectures like this. And then I would like all of you to please subscribe the channel and click the link for the updates so that we can stay tuned and updated on the new updates for the different lectures we have for the YouTube channel. Anything else anybody would like to add? Dr. Farah, Dr. Camille, anything?
I think it was a great program and some really, really good questions from the community. So it was educational for everybody. I learned a few things as well. So
yes, thank you so much for having me. I thought the panel was excellent. Great questions. And the last thing what I will leave our audience with is, remember, prevention is key. Please take the vaccine when it is available to you. I know there's a lot of talks going around that are not necessarily true. The fears in the community of the vaccine. So I do want to touch on that a little bit. I've heard things like, myths, basically not true. Concerns of paralysis and symptoms that are going to create a lot of fear in the community from taking this vaccine. But to draw a perspective on that, in the phase 3 trial of the vaccine that's just been FDA approved, the Pfizer one, there were 44,000 subjects that were studied, and only 4 had something called Bell's palsy, which is temporary weakness or paralysis of the facial muscle, and all 4 resolved by the end of it. So you think about it, 44,000 and only 4. It's very minimal, and that could probably be seen in any other vaccine as well if we were to look at the data. So I want to encourage the community from not being fearful of the vaccine. The risks are little from what we know. It does have two doses. Please do take both of them when it does become available to you. I think it's going to be very important that we communicate and educate our community regarding this matter. So thank you for having me. It was a real pleasure.
That is a great point, Dr. Farah. Thank you. Really, really nice way to end the talk, that topic.
Thank you.
Thank you so much. With this, I would like to thank our community for attending this informative lecture and taking time out. Dr. Hussain, thank you so much for your time.
You're welcome.
Dr. Camille and Dr. Farah, thank you so much for giving your time and enlightening us about different aspects of COVID-19 and its effects on the heart. Thank you.